Hi, everyone. My name is Caitlin Angelillo, and I'm the branch director for our Woburn office and work directly with our telemonitoring department. This presentation is designed to introduce you or reintroduce you to Beth Israel Lahey Health at Home's telemonitoring model and highlight what we can do to assist you in successfully managing patient care in the home setting. Who should have telemonitoring? Please present telemonitoring to all home health patients as if telemonitoring is another discipline ordered unless it would be unsafe for a patient. The reason why we ask for you to consider all patients for our telemonitoring department is we know at this point many patients have multiple comorbidities. And what we found is historically, if patients accept telemonitoring, they're more involved in their self-care. And as a result, their rehospitalization rates are lower. The telemonitoring department consistently has a rehospitalization rate of less than 10%. Assess patient appropriateness and safety. Does the patient have a memory issue, dexterity issue, or an issue with balance, and as a result, would they be unsafe to manage the equipment? If they do have one of these issues but have an available caregiver to assist them consistently, we can still accept a referral to the department. Can the patient only safely do certain telemonitoring tests? That's not a problem as well. And please just communicate upon referral which specific equipment the patient would like. An irregular heart rate. You can monitor patients' weights as well as their pulse ox when a patient has an irregular heart rate, but unfortunately, we can't include a blood pressure cuff during the install. And the reason why is what we found is because it's an automated cuff, irregular rhythms are not picked up accurately. And as a result, we were receiving consistent erroneous readings, and we do not feel comfortable reporting readings off of our blood pressure machines for patients that have irregular rhythms to physicians. Poor balance with no available assistance, no problem at all. We can install telemonitoring without a scale. If you are referring a patient to telemonitoring, please use the smart text, and the smart text includes equipment you're requesting, patient's primary diagnosis, the patient's arm circumference, and the patient's heart rhythm. Arm circumference. So the reason why we need the arm circumference is we actually have two sets of blood pressure equipment, and based on the patient's arm size, these machines are not interchangeable. Not having an arm circumference will delay the install process. So some patients have what we would consider a regular size arm, and that is sometimes what comes in on our referral requests. However, what we found is sometimes people assume that a patient has a regular size arm, but unfortunately it does fall into our small category. And the same thing, sometimes patients fall into our medium cuff category. So what we do ask is that every single patient have an arm circumference. We can't install without one because the installers can't have multiple sets of equipment in their car. They just don't have the room. PT only cases, we do ask that upon admission, that the PT does call the physician's office and ask for a skilled nursing eval if they are going to be putting in telemonitoring. What we found is some of our therapists feel like nursing is not necessarily needed, but they would like the support of telemonitoring. And then having that nursing eval available if there is an issue allows telemonitoring and our nursing department to be able to meet patient care needs faster because we already have the nursing eval ready to go. If you're ordering telemonitoring, the order should be added to the care plan by the field clinician and communicated to telemonitoring via the Epic in basket. So you can do this by choosing either a case communication visit type, if this is outside of a visit, or using the case communication within a visit, and then you route it to P space HH space telemonitoring space referral. Communication. So the way that we look at communication for our telemonitoring department is two ways. If you're having any issues with equipment or would like to place a referral, please send that to Epic. So equipment equals Epic. And then all other concerns for the department, nursing questions specifically, or nursing support, that goes via Gmail. Protocols. Perform a quality check. So the first visit after install, whoever that clinician is, whether it's nursing, PT, or OT, we ask that clinician to perform a quality check. And then what the quality check consists of is assessing a manual set of vital signs, waiting 5 minutes or so, and then checking a set of vital signs using the telemonitoring equipment and comparing the data. We also ask from a clinical perspective that you reteach the patient how to use the equipment properly, because the equipment is installed by somebody that's non-clinical. And then we ask that you update the telemonitoring department with any discrepancies. What that does is it allows the telemonitoring department to truly realize that the equipment is working properly. And as a result of that, between clinician visits, the telemonitoring department is essentially going to own your patient's care. They will follow up with physicians directly. They will ask for med changes as appropriately directly. They will update you with these changes. And then if they feel like a patient truly needs a PRN visit, they will let you know. Discharges. Please request equipment pickup 1 week prior to your discharge in Epic. And I'll explain that further later on. Before you do plan to discharge a patient, please ensure that the patient has either bought a new scale or has a scale, and then compare the telemonitoring scale to the patient's home scale so they have their new baseline, and then power down the tablet and place all equipment in the bin. Telemonitoring basics. Clinicians should use telemonitoring equipment for all vital signs assessments during visits after the quality check has been completed. The reason why we ask you to do this is, unfortunately, Philips, which is our software for telemonitoring, and Epic do not communicate with each other. So the only place that will have a consistent set of vital signs is in Philips. So if we're always using the equipment, we have our consistent set of vital signs. Vital signs outside of Beth Israel Lahey Health at Home's parameters should be reported to physicians' offices and heart failure clinics in the day. A review of the parameters is as follows: heart rate less than 50 or greater than 100, blood pressure less than 90 over 50 or greater than 160 over 89, an O2 sat of less than 92%, and then a weight gain of greater than 2 pounds in 1 day or greater than 5 pounds in 1 week. Telemonitoring will alert you via email if you are seeing a patient that day and the patient's vital signs and weights alert, which means that they're outside of parameters. Protocol is that if a patient has abnormal results on the day of a nursing, PT, or OT visit, that the clinician seeing the patient is responsible for following up on results. Please respond by hitting reply all within the hour with a confirmation that you are seeing the patient. If we assess an alert early in the morning, or we haven't received a confirmation within the hour, and we feel like the results are especially concerning, our telemonitoring nurses will, however, call the patient and make sure that they're okay. What else can we help you with? We can do your wellness calls if your patient is active with telemonitoring, if you're off or have a high caseload. So we ask that you also think about PDGM and what the asks are for Medicare. We're empowering patients to take care of themselves, and we're allowing patients time to be able to show us that they can take care of themselves with us doing assessments to make sure that they're on track. So the way that you can place a phone call on our telemonitoring nurse schedule is actually by placing a telephone encounter on your patient's visit set in the patient's care plan and assign the clinician to telemonitoring as the provider, and then fill in the appointment notes with what you would like us to follow up with. Please place calls on the patient's schedule with 24 hours notice. If in the day you realize that a patient does need a call and you're unable to make that call, telemonitoring is still happy to help. But if you're going to be placing a phone call on our schedule, we ask that you please send an email via Gmail to our telemonitoring nurse group. Okay, what else can we help you with? We do fax trends to doctors at your request. So because Epic and Philips don't talk to each other, we'll send the data to the physician's office for you. Please email us your request and the MD's name and fax number, and we'll take care of that for you. What we do ask is specifically if you have a patient that's going for their follow-up PCP appointment or follow-up with their cardiologist, we're happy to send that the day before. So then the physician has the information for the appointment. So just send us the request and we'll do that. The CHF clinic in Burlington and then the CHF clinic that covers Peabody and Danvers, they do automatically receive weekly trends from us, so you don't have to request trends to be sent on patients that are followed by those two locations. If patients are interested in keeping equipment after agency discharge, we do offer private pay services. Unfortunately, the service line is on hold, however, but we will update you when this becomes available. We also have our Tufts Enhanced program, which is essentially a different version of our private pay program that will soon be rolled out to our Watertown office, but for our Beverly and Woburn offices, as long as the physician participates in a program with Tufts, and you can check with your Tufts case manager, patients can actually keep the telemonitoring equipment at no cost to the patient, and Tufts pays for it. We have 5 installers who service the Leahy Health at Home map. And what that means for you is please do not pick up equipment. We'll do that for you. We just ask that upon discharge that you place the equipment in the bin as the previous slide stated. Equipment is malfunctioning. We actually have a troubleshoot guide available for you, so you can actually figure out or try to figure out the issue during your patient visit. The troubleshoot guide link is listed on the slide deck here, and you can actually find that in the Google Drive. If you're unable to figure out the issue, no problem at all. Just send a troubleshoot request through the Epic in-basket to the telemonitoring group. So that includes our presentation. We have set up Q&A sessions that will start shortly. Please note your questions. You can also email them to the telemonitoring department, and we're happy to answer those questions for you as well. Hope you have a great day. Thank you.